Hello everyone. How are you? Hello everyone. Let's start with contraception. Hello everyone. Let's start with contraception. Is the audio video clear? Okay, let's start it. We will be starting with Pearl's index. What is Pearl's index? Pearl index is the if a contraception is used for 100 for 1 year by the 100 women, then how much there was a contraception failure out of that 100 women, how much women conceived. So it is expressed in 100 women year. It is expressed in 100 women year. Okay, so in other words, Pearl indexes contraception failure. Higher is the Pearl index, lower is the efficiency of the contraception. Okay, higher is the Pearl index, lower is the efficiency of the contraception. What is the Pearl's index of the natural method? So in this you just have to have an idea. Okay, it is not that it will be asked to you. You will be asked of the order in which way they are efficient and in which way they are not efficient. The Pearl's index of natural method is 25. The barrier is 15 to 20. Okay, the barrier is 15 to 20. And pelvic organ progesterone only pills is 1 to 2. It is 0.5 to 1 for copper T, and it is for the combined oral contraceptive pill, it is 0.1 to 0.5. Okay, here I would like to tell you that if you compare copper T and combined oral contraceptive pill, that I always tell you ki the main contraceptives which we have got in India by the government, or the only two main things in our bucket is copper T and combined oral contraceptive pills. So you just remember this: combined copper T is near about 1, and combined oral contraceptive is less than 0.5. Okay, of course, tubectomy and vasectomy will be lower than it. Tubectomy is 0.2 and vasectomy is much lower. And here again, one point you have to remember, that implants have the least contraception failure index. Implants have the least contraception failure index. Okay, so they are much better than the surgery. Is it okay? Let us see what are LAC. Many times the question has repeated, but it has not come in the NEET FMG. It has come in NEET PG. It has come twice in NEET PG. It has come twice in INSET. So this time there's a much chance that this question will come from for you. What is LAC? LA stands for long acting. LA of the LAC stand for long acting. It means you have not to take that daily. Okay, it as per Williams definition, it has to be taken at least once a month. Okay, it can be taken more, okay, even more than one, but at least it has to be taken once a month. So because it is to be taken once a month, so you will not include barriers or pills, because barriers, they have to be used at the time of intercourse, and pills, they have to be used at the time of uh, daily. Pills have to be used daily, so you will never include barriers or pills. Okay, and RC stand for reversible, they should not be permanent. So in the LARC, you will never include ligation methods. Okay, you will never include ligation methods. So what is basically the lark? The lark is one which has to be taken at least once in a month or more longer, and it is reversible. So you are not, question comes on that, which is not a lark, which is not a lark. So what are not a lark? The one which is one which are not barriers, okay, not pills and not ligation. Always remember, answer to the question lies that LARC are reversible and ligation is irreversible. What does then LARC includes? It includes copper T and progesterone sustained release, those DAMPA injection, deoxyprogesterone acetate, Mirena, and implants. Okay, so that is what the LARC includes. Okay, so the question is surely going to come from this slide. Not a lark is the tubal ligations, the vasectomies or sterilization procedure, barriers and pills. And what are lark? Copper T and progesterone sustained release methods. Okay, now let us see, as I already told you, we have only two contraceptions in our hand when we are in India. One is combined oral contraceptive pill and another is copper T. Combined oral contraceptive pill is very important, as is important copper T. So let's discuss its contraindication. As a doctor, you should not give combined oral contraceptive pill to whom it is contraindicated. So contraindications are most frequently asked, and you should know that. The estrogen in the combined oral contraceptive pill causes increased coagulation. Okay, the estrogen causes increased coagulation. So Virchow triad says that if there is endothelial damage, stasis and thrombosis disorder, then there is high coagulation tendency, because estrogen increases the coagulation. So we cannot give the combined oral contraceptive pills. As per Virchow says that in Virchow triad, if there is endothelial damage, then also there is high coagulation tendencies. So endothelial damage is in which conditions? When the BP is more than 160/100, when it is diabetes mellitus with vasculopathy, it is migraine with aura, and the person is age is more than 35, and it is the person is smoker. Okay, so the endothelial gets damaged in these four conditions. We will remember the BP is hypertension patient more than 160/100, diabetes with vasculopathy, not a simple diabetes, migraine with aura. Okay, migraine with aura or with any neurological deficit, age is more than 35, plus the patient is smoker. Stasis means the blood flow is very weak. There is stasis. So it is there in the heart and the brain diseases. For any heart diseases, valvular heart disease, coronary heart diseases, or congenital heart diseases, any heart diseases. Thrombosis disorder. Of course, if already thrombosis is there and estrogen will increase the coagulation, there will be problem. So thrombophilia, in thrombophilia patients, you are never going to give combined oral contraceptive pills. And in the postpartum phase, everybody knows that pregnancy is a hypercoagulable stage, right? So it takes 6 weeks for the coagulation factor to get normal. It takes 6 weeks. So in the postpartum phase, you are not going to give the combined oral contraceptive pills for the 6 weeks because the coagulation factors are already high. It takes 6 weeks for the coagulation factors to normalize. Okay. Next is lactation. Estrogen component, it interferes with lactation, it suppresses the lactation, but very important, it suppresses the lactation only for 6 months. So you are not going to give to a lactating mother after 6 months of delivery. After 6 months you can give. Okay, but if it is a IUD or any couple has given their baby or someone has adopted their baby, okay, then you can give that person combined oral contraceptive pills after 6 weeks. But if that person is lactating, so you have to give it after 6 months. Usually the females, they lactate. Okay, it's a normal thing. So unless and until it is IUD, they will not write a postpartum patient is coming to you after 6 months or after 6 weeks, whether you will give combined oral contraceptive pill or not. This is a very favorite question of the FMG. So you will not give the combined oral contraceptive pill to a lactating mother for the first 6 months. Active liver diseases, because estrogen and progesterone are metabolized in the liver, and if there is active liver diseases, so they will not get metabolized and you are not going to give to the patient of active liver diseases. I think I have shortened your list, hopefully. Once again, the contraindications of combined oral contraceptive pills, only 5 points you have to remember. First 3 points are the virtue triads. Okay, virtue says if the endothelial damage, stasis and thrombosis disorder are there, then there will be increased coagulation tendencies. Okay, coagulation will occur, and you know that estrogen increases the coagulation. So you are not going to give the combined oral contraceptive pill in these 3 conditions. Endothelial damage is in hypertension, diabetes, is mellitus with vasculopathy, and migraine with aura, and age more than 35 years in a smoker. Stasis is in the heart and brain diseases, any heart diseases, coronary heart diseases, valvular heart diseases, congenital heart diseases, any heart diseases beta, and brain diseases. Brain diseases is stroke or any problem in the brain. Okay, and thrombosis disorder, any hereditary or congenital thrombophilia or any thrombophilia at present. And postpartum, in postpartum there is increase in the coagulation factor up till 6 weeks. Okay, lactation, to a lactating mother you will never give combined oral contraceptive pill up till 6 months, and lactation is quite a normal thing. So you will not, examiner will not write, examiner will just write the delivery has occurred. Active liver diseases, because the estrogen and progesterone both are metabolized in the liver, and if liver is not if liver is in a diseases form, not chronic, liver is in a diseases form actively, then it will not metabolize and it will lead to toxicity. What is the mode of action of combined oral contraceptive pill? This you all know. I will short it very soon, that it blocks the HPO axis. So no release of gonadotropin releasing hormone, no release of FSH, no release of LH, so, and no ovulation as such. Okay, what is it action on endometrium? Okay, now all there I specifically says the estrogen in the combined oral contraceptive pill is much less in amount as compared to the natural estrogen. In the combined oral contraceptive pill, the estrogen is very less as compared to the natural estrogen which is produced by the HPO axis. So the progesterone action will be dominant. So in the endometrium, there is endometrium thinning, the fallopian tubes motility is decreased because progesterone decreases the fallopian tube motility. You all know that the cervical mucus will be thick. The cervical mucus will be thick. Okay, so the progesterone dominant action is there. Once again, I would like to tell you the progesterone dominant action is there, and HPO axis get blocked. This is the main. So there is decreased FSH and decreased LH. Decreased LH causes no ovulation and decreased FSH causes no. So main action is this, as no ovulation and decreased FSH. Now, what is missed pill? How to manage the missed pill? So, if a lady has been taking combined oral contraceptive pill is started from day 1 to day 5. Any of the day they can be started. If it is started on that day, then spontaneously from the next day, the contraception effect comes. Contraception effect comes from the next day. But if it is started on any other day, then contraception effect takes 7 days to come. 7 days to come. Okay, so contraception effect takes 7 days to come if it is started on any other day. And once the contraception effect is established, the contraception effect goes in 2 days. Contraception effect goes in 2 days. So here I would like to tell you very simple thing, that if the patient has, if the client has stopped taking the contraception pill, okay, if the client has stopped taking or forgets to take one pill, because contraception effect goes in 2 days. Contraception effect goes in 2 days. So missing one pill is nothing. Nothing happens. The patient should take the next pill as soon as he remembers. No need to take 2 pills. But if the patient forgets, if the client forgets to take 2 pills, now you know that contraception effect goes in 2 days. So now the contraception effect has gone. Okay, so the contraception effect has gone. Now next effect will come in 7 days. So emergency other method of contraception for 7 days. Other method of contraception for 7 days. Okay, for 7 days, and usually the barrier are used. Okay, there is something you can do extra. What you can do extra, if in addition to the using the barriers for 7 days, if the pills are missed in first week, okay, pills are given like 3 weeks and then 1 week gap, 1 week iron pills, then 3 weeks. If the pills are missed in the first, good evening Dr. Rachna, good evening Dr. Isra. If the pill is missed in the first week, then emergency contraceptive are taken. And if the pills are missed in second week, nothing to do. Nothing to do extra. And if the pills are missed in the 3 week, if the pills are missed in the 3rd week, then one has to omit the pill-free period. This 1 week gap which we are giving, we need not to give that gap. Omit the pill-free period. Once again, usually the contraceptive pills, hello Dr. Kavita, usually the contraceptive pills are started from day 1 to day 5. If they are started from day 1 to day 5, the contraception effect comes spontaneously. Okay, but if the pills are started on any other day, then the contraception effect takes 7 days to come. Okay, contraception effect takes 7 days to come. And if once the contraception effect has been established, once the contraception effect has been established, then it goes in 2 days. So mainly you have to remember the 7 and 2. Okay, the if one pill is missed, then it is not a problem because contraception effect goes in 2 days, so no problem. If two pills are missed, then contraception effect has gone. To re-establish the contraception effect, one has to wait for the 7 days. So use barrier for 7 days. If the pills are missed in first week, then this is something additional you have to do. Emergency contraception is to be taken if there is a history of intercourse. And in the second week, you have to do nothing. And in the third week, you have to, if the pills are missed in the third week, then you have to omit the pill-free period. Now let's start with non-contraceptive benefits. This is the zone from where the FMG question is expected this time. Okay, what is the non-contraceptive benefits of combined oral contraceptive pills? Okay, first of all, as I already told you before, that the estrogen level in the combined oral contraceptive pills is much less as compared to the estrogen level which is maintained in our body by HPO axis. HPO axis has been shut down by the combined oral contraceptive pills. Now we are dependent on the combined oral contraceptive pills for estrogen. Now our body has gone into a decreased estrogenic condition. Okay, so in all the estrogenic conditions, it is benefit. Okay, so if you have to remember, then you will say in increased estrogenic condition, it is benefited. So what are the increased estrogenic conditions? First of all, there are estrogenic cancers. What are the estrogenic cancers? CA ovary, CA endometrium, CA breast, colon cancer. These are the four estrogenic cancer. Okay, what is it? CA ovary, CA breast, CA endometrium and colon cancer. Except CA breast, it is beneficial in all. This is very important. A layman always think that contraception pills has a bad effect on the on our body and every cancer increases, but you should know that the cancers tendency is decreased. All the estrogenic cancer tendencies are decreased, so they are very beneficial in estrogenic cancers except CA breast. On CA breast there is no effect, neither positive nor negative, no effect. Now in all the benign estrogenic condition which we studied in gynae, can you write down in the chat box what are the estrogenic conditions of gynae? It is fibroid, adenomyosis, endometriosis and PCOS. In all these conditions, there are hyperestrogen levels. So these problems are occurring. So if the patient is taking combined oral contraceptive pills, then these conditions are cured automatically. So benign estrogenic conditions of gynae. Another is very good, Dr. Rakesh Patel. Benign ovarian and breast estrogenic condition. What are benign ovarian and breast estrogenic condition? Can you tell me what are benign ovarian and breast estrogenic conditions? They are ovarian cyst. Okay, they are ovarian cyst. They are fibroadenosis. So in all this condition, other than this, as you know that there is endometrium thinning. So it can be given in abnormal uterine bleeding. All the menorrhagias, all the irregular sporting metorrhagias, and there is very normalization of the I think there is a problem. Let me see.